A brain tumor is an abnormal growth of cells in or around the brain. Some are slow-growing and harmless. Others are aggressive and life-threatening. Today, let's break down the risks, warning signs, treatment options, and what the future can look like after diagnosis. Brain tumors can happen to anyone, but some factors raise the risk. Certain inherited genetic syndromes, like Li-Fraumeni syndrome, increased tumor likelihood. Exposure to high doses of radiation, especially in childhood, can also raise the risk. People with weakened immune systems, for example, transplant recipients or those living with HIV, are more vulnerable to certain tumors. And while most brain tumors aren't directly linked to lifestyle, researchers continue to explore possible connections to environmental toxins and long-term chemical exposure. Symptoms depend on the tumor's size, location, and growth rate. Persistent headaches, especially worse in the morning or with coughing, are a common sign. Nausea and vomiting without a clear cause. Weakness or numbness on one side of the body. Difficulty speaking or understanding words. Vision problems like double vision or partial vision loss. Seizures in someone with no seizure history. And sometimes personality changes, memory issues, or trouble concentrating. These happen because a tumor takes up space inside the skull, increasing pressure or interfering with how brain regions communicate. When a brain tumor is suspected, doctors often begin with an MRI or CT scan to get a clear look inside the brain. If a tumor is found, a biopsy, taking a small tissue sample, may be performed to determine its type and grade. This helps decide whether it's benign or malignant and shapes the treatment plan. Treatment depends on the tumor's type, size, location, and the patient's overall health. Surgery is often the first choice for tumors that can be reached safely. The aim is to remove as much as possible without harming healthy brain tissue. Radiation therapy uses high-energy beams to destroy remaining cancer cells or treat inoperable tumors. Chemotherapy, given as pills or through and for, targets rapidly dividing cells. Targeted therapy zeroes in on specific molecular features of tumor cells, sparing more normal tissue. Steroids can reduce swelling, while anti-seizure medicines help control symptoms. In some slow-growing tumors, doctors may recommend a watch-and-wait approach, using regular scans to track growth before intervening. Prognosis varies. Benign tumors, if fully removed, may never return. Malignant brain tumors can be more challenging, but new therapies are improving outcomes every year. Survival depends on tumor type, grade, surgical results, patient age, and overall health. Early detection and treatment can extend life, preserve function, and in many cases, lead to long-term survival. If you or someone you love has worrying symptoms, get checked early. Because when it comes to the brain, every moment matters.